Hi, you guys. Welcome to Ask the Egg Whisperer. Let's get started. For those of you who are like, what is this Ask the Egg Whisperer? Easy. Go to asktheeggwhisperer.com, put in your question there, and voila. I got 4 pages of typed questions right here, and I'll answer them for you. My assistant, Paula, actually she's my producer, she actually said to me today that I've answered 655 of your questions since I started Ask the Egg Whisperer. That's not included the live chatted questions that you guys chat while I'm hanging out with you. So thanks for doing that. I feel like the questions that you guys ask help other people realize that they're not alone and that the troubles that everyone is having right now are just really like part of the human condition. And by hearing about other people's strength and resiliency, you hopefully will find the strength that you need. And I think you kind of already have too. I think most people who are listening and watching right now, you guys are pretty powerful and pretty darn awesome. Okay, let's start here. Tracy says, hi, Dr. Aimee. I'm 29 and my husband is 39. I have hypothalamic amenorrhea. Let's see how many words I can butcher today. And diminished ovarian reserve. The HA, hypothalamic amenorrhea, is because I'm a bit underweight from a partial colon resection and gut issues. I've had 2 egg retrievals. Here we go. The first egg retrieval, 3 fertilized after 7 retrieved. 1 blast tested abnormally. The second retrieval, we added omnitrope and dexamethasone during stimulation. ICSI and calcium solution to the eggs. 5 retrieved, 1 fertilized, 1 blast, and it was normal. I eat very well, ton of supplements, meditate, acupuncture. Tracy's basically describing fertility team. Therapy, eating, exercise, acupuncture, meditation. Fertilityteam.com, people. You know I have a .com for everything. Any ideas on why I have such poor fertilization is your question. Do you think I have poor quality eggs or is it the protocol that's hurting them? Should we be testing my husband's sperm further? What would you do for my next cycle? Both cycles were Menopur, Gonalef, Cetrotide, HCG trigger. Oh, and the husband's sperm tests are normal. I want to bank at least 3 to 4 embryos before my first transfer because I want 2 kids. Thank you for being such a guiding light. Tracy, you're basically doing and asking all the questions that I would definitely be asking as well. I'm kind of like superstitious. I'm just like, okay, you got a normal in that cycle where you did what you did, the 5 retrieved, 1 fertilized, 1 blast tested normal. I would be like, do exactly what you did there. I think at 29, it's hard to have cycles that don't work because like at 29, they're supposed to work. And I think people sometimes make assumptions. And I certainly sometimes have been in that situation where I'm like, oh, everything should be great. And you're just like, oh, it's not. And it really sucks when you make these assumptions. So I think in your situation, when you have 5 retrieved or 7 retrieved, we know that your egg count's a little bit on the lower side, but you obviously still have good eggs because you're 29. So that's really awesome. But in a case like this, I would do chromosome analysis. I would look at Fragile X carrier screen if you haven't already. I would kind of look at maybe some autoimmune issues, potentially. You know, I don't know if any of that kind of runs in your family. I have a hair that's sticking to this brand new lip gloss that I just got. I couldn't go on with that stuck to my lip. So that, you know, maybe sometimes there are some treatments that if you are positive for anything could potentially help maybe for transfer, for example, but it also might help you get a better response. It looks like maybe your doctor already thought of something like that by giving you dexamethasone during that stimulation as well. I think you're right on track for also doing the HGH. If you haven't already, that might be something else that can help. I don't read, oh, you did. The second retrieval, you did HGH, which is the omnitrope. So definitely do that again. And maybe do that in between cycles too. So do a cycle with HGH, prime with HGH, take a break for a month, and then do HGH again. As far as your husband, if his tests look fabulous, I mean, he's 39, so you can be like, well, Dr. Aimee says you're almost 40, so maybe do a sperm DNA fragmentation test and do a chromosome analysis on him too. I think that might be helpful. And I imagine your doctors did ICSI, just like you said, but if there's something else that they want to do, you know, maybe run the sperm through a Zymote chip, go to Zymote Fertility for you guys who don't know what that is and learn more about it and see if your doctor would add that as well to your cycle. Okay, next question is from Amanda. Amanda says, hi, Dr. Aimee, I love your show. Thank you for all the information you've given us. I have a long story, but let's dive in. Okay, here we go. I got pregnant naturally with my first baby, but went into preterm labor at 24 and a half weeks due to cervical incompetence, and the baby passed away. I'm sorry, Amanda. After he passed, we started trying to get pregnant again. We got pregnant in May of 2020, but miscarried at 6 weeks. We've been trying for 15 months now, and we've done 5 medicated cycles, 2 IUIs that both failed. I have PCOS, and my BMI is 48. I don't have blocked tubes as determined from HSG. Should we move to IVF or keep trying IUIs? Can you do IVF with a high BMI? Also, if we can do IVF, can we transfer 2 embryos even with my cervical incompetence? Amanda, you've been through so much. Here is my message to you. Your fertility is not skin deep. It's not about your BMI, but having a healthy lifestyle is extremely important. So if you're a patient of mine, I would say let's build that fertility team around you. We know that a woman who has a BMI, especially over 40, is at higher risk of preterm labor and preterm delivery. So let's see what we can do that's in your control to, I don't want to focus on bringing the BMI down. I think that's really unfair, and I think that's really hard to do, especially when you've had so much loss. I'm thinking about things like keeping a food diary, talking to a therapist, having a team. Go to foodfuels.com, work with Coach Nina. Juna, Juna, has a wonderful pre-pregnancy nutrition app as well. But this is a situation where I'm like, let's get like a whole bunch of people like surrounding you, loving you, and like just rallying around you. And now I just thought of fertilityrally.com. You know, that's what you need. You need people that believe in you, believe in your fertility, and believe that you deserve to be a mother just like I do, no matter what your body size. Get a metabolic workup done. See what metabolic levels are right now for you, looking at your glucose, for example, your cholesterol, and let's start treating everything if there are any abnormalities. But I'm rooting for you, Amanda. You can do IVF. Not every center can do IVF for someone who has a BMI over 40, but there certainly are centers that do. So find those centers. I know where they're at. I'm not sure where you live based on your question here, but if you really want to find out more from me, feel free to direct message me in Instagram, or I'm easy to find. Okay. Next question is from Allie. Allie says, my first FET failed. I got a fever of 101 15 hours after the transfer. The fever lasted 2 to 3 days, but persisted as a low-grade fever until I stopped the progesterone shots at 12 days post-transfer. I was using sesame seed oil. My doctor suggested it might have been an immune reaction, but hasn't suggested any immune testing and is only suggesting increasing prednisone for the next transfer. It's taken me 4 more cycles to get another genetically normal blast. I have 1 child, my second pregnancy, and I miscarried my first pregnancy, also after a fever early on, both non-IVF. Interesting. I have allergies and got proctitis during my successful pregnancy. I generally get strong immune reactions, get a fever almost anytime I get a cold. Any thoughts about immune tests I should have or immune protocols for my next FET with my last precious embryo? Have you experienced people getting fevers after transfers? It didn't seem to be an illness. Allie, I totally have. And actually that progesterone little tidbit that you shared with us, that you took progesterone and then once you stopped it, the fever went away, that could be, you know, the biggest puzzle piece here. And so in a case like yours, I would actually run you through a mock cycle first before I even put an embryo in. And I would run your mock cycle with progesterone and ethyl oleate. And I would say there is still a good chance that even with that form of progesterone, you'll still have a period. Not a period. You guys, come on. Fever. You know, the fever is what we're talking about, that you might still have a fever. So you might be someone who would do much better with endometrine instead. So these are the vaginal inserts that you place 3 times a day. And I monitor progesterones very closely on patients who use endometrine. My goal level is above 10. And I check a progesterone level the day before the transfer and then 4 days after the transfer and then with a positive pregnancy test. And I always just want to make sure that if I need to, I can add progesterone like an endometrine. So they do it 8, noon, 4, and 8. And then sometimes I even add a progesterone capsule. And this has worked really well in my patients who've had fevers from progesterone and oil. It is a thing, definitely a thing. This next question is from Ari. Ari says, hello, I found your YouTube channel, but I didn't want to comment publicly because I'm feeling a little insecure. I'm 30 and I have not seen clear egg white cervical mucus since I was 16. What does this mean? I've also tried to conceive for 14 years with no luck at all. Okay, Ari. TUSHYmethod.com. Those are the 5 fertility tests that you can do to kind of figure out what's going on, to find a diagnosis. Let's break it down for you. Tubes, uterus, sperm, hormones, your genetics. You can do all 5 tests in basically 1 menstrual cycle. Period starts, cycle day 3, get your hormones checked in all your preconception labs. Go in for an ultrasound, have them order an HSG, done cycle days 8 through 10. Send off your sperm. You can use meetfellow.com as a really cool way to do-it-yourself sperm. Do-it-yourself sperm. That is a thing. I'm brainstorming about the thing that I'm thinking about. But do-it-yourself sperm testing kit that you can have shipped to your home. And then when you go see the doctor for the ultrasound, they can do all the genetic carrier screen, chromosome analysis as well. And voila, bam, what's up? 30 days, you basically have a fertility diagnosis. And that might tell you why you are not seeing as much cervical mucus, right? So there might be something about the lining of your uterus. There might be something off with your hormones. Those are all the things that I want you to know. It's been 14 years, Ari. Let's find out. This next question is from Kathy. Kathy said, I'm 42 and I have a birthday this month. I conceived my daughter 1 month shy of 40 through IVF. My AMH is 1.23. My FSH is 1.23 and FSH is 7.8. Do I have a chance for a sibling? And the answer is, Kathy, if there's anyone at 42 who has a chance for a sibling, it's you. However, no matter what your levels are at 42, it's still really hard to find a good egg. So be open to all possibilities, meaning it might take more than one cycle, and hopefully you'll get it done within the first 2 to 4. And you're like, what? 2 to 4? Let me tell you, if someone didn't give you that expectation, you thought you were just going to get it one and done, that would be really unfair. And I like to have hope, and you guys all know what hope means. Have only practical and pragmatic expectations. We can still be really positive and hopeful, but at the same time, we should have realistic expectations. So when we find out that something didn't work, it's not like we weren't possibly thinking about what would we do if that didn't work. You know, I always like to talk about, if we do this and it doesn't work, what are we going to do next? So if you're a patient of mine, I would be like, we're going to try again. We're going to regroup. We're going to do a post-IVF consult. I go through all the things that I talk to you guys about, the embryo diamonds, all the 8 things that you need to know about your embryos, so that we can figure out what we're going to do next and when. Next question is from Iris. Iris says, I'm 40. I have a myoma. A myoma is another way of saying a fibroid. The biggest is 6 centimeters, and I want to remove it. But my gynecologist said that they will remove my uterus, and I've not had children yet, and I want to. What advice do you have for me? Thank you. Okay, Iris, let me tell you. You're a young fertile woman as far as I'm concerned. However, a lot of OBGYNs, they think of 40 as like, what are you thinking? Like, you know, they kind of insert their own personal bias into the situation. They're like, you wouldn't want to have a baby at 40. You're going to be so tired. Honestly, I feel like I'm running around at 25 years of age. I have a ton of energy. I can totally relate to a 40-year-old woman who's like, I'm ready for a baby. Please don't remove my uterus. So it's time to do a little switcheroo and find a doctor that believes in your fertility and believes in your uterus. However, there might be a really good reason why your doctor is saying you need a hysterectomy. Your uterus might be riddled with fibroids. So get your AMH level checked. Let's figure out what's going on with your hormone levels. See if you should do an egg retrieval before you have your surgery, or you have your surgery first and then an egg retrieval afterwards. So in a case like yours, I would actually bring you in for an ultrasound. I would put the probe in, I would look at your ovaries, and I'd be like, with these big fibroids, can I reach your ovaries? If the answer is yes, then I'll try and do the egg retrieval first. If I cannot reach your ovaries, then I say, I can't reach your ovaries. It's impossible. The fibroids need to be removed. So literally like 2 weeks after the fibroid surgery, if you feel good enough to be able to drive to my office, then we'll start planning your IVF cycle and we'll get some embryos frozen. And then your doctor will give us the all clear. With big fibroids that are all over the uterus, sometimes doctors say 3, 6 months, even 9 months until you can get pregnant again. It just really depends on the surgeon's experience in that surgical case with you. And then after surgery, they'll give their final recommendation as far as how long you need to wait to get pregnant. Next question is from Heather. Heather says, I'm 36, husband's 30. Go, Heather, younger man. I was going to make like a tiger, what is it, a cougar sound? I don't even know what a cougar says. Go, Heather. Trying to conceive for 2 years. We did 2 IVF rounds. The first produced 1 PGT normal embryo and the second 7 normal embryos. Wow, that's really cool. We're planning for our first transfer in January. Diagnosis unexplained. HSG test was clear. Hysteroscopy was clear. I did an ERA receptiva test. Both came back positive. My H score was 1.8. Questions are this. Does a score of 1.8 mean I have endometriosis for sure? It's lower than most scores I've seen. My RE wants to try a transfer too, but if they fail, then we'll treat with Lupron. Thanks. So Heather, here's what I would do in a case like yours. So it sounds like you got really lucky the second cycle, but I'm wondering if maybe the issue is that it just takes a lot of eggs for you to finally make a normal embryo, and that second cycle was just sheer luck, you know? So it could be that it's just you're 36 and you actually probably don't really have a problem, except maybe there's an age issue and that's it. Not that 36 is old, because we all know it is not old. So my thinking is BCL6 H score. H stands for histologic score. Histology means staining of cells, of 1.8. You're right, it's just barely elevated. So in a case like this, I would do this. Let's go back to basics. Let's check your fallopian tubes. Let's make sure there isn't a hydrosalpinx. let's take a close look at your uterus and making sure that we don't think that there might be adenomyosis. If the HSG is normal and there's no tubal dilation, then maybe skip a laparoscopy. If the HSG shows a dilated fallopian tube, then let's take that tube and put it in a jar because it's not helping us. That could be the diagnosis. And putting an embryo in someone's uterus when you have a hydrosalpinx can decrease your implantation rate and cause a negative pregnancy test, a miscarriage. And then one of the worst things that can happen is, well, there are a lot of bad things that can happen. Not to scare you guys, but that's an ectopic pregnancy. So that's just like everything you need to know about a hydrosalpinx in, 10 seconds or less. Not that Heather was asking, but, I'm just sharing that with you anyways. So the other thing that I would consider doing is not Depolupron, but you add just a little bit of something, something. And the something, something is a little letrozole. So letrozole, also known as Femera, I give it to my patients for when you have an H score of only 1.8, just 5 days. So 2 tablets per night for 5 nights, starting when you start estrogen. That's it. It works beautifully. There are studies that show that it works, and I anecdotally, and in my, not just anecdotally, but in my practice, I use it quite commonly for patients who have a mildly elevated BCL6 of 1.8. I usually tell patients I really wouldn't worry too much about it. So I hope that helps. Next question is from Nina. Nina, my mom's name is Nina, and you actually said I'm beautiful and funny. But my mother doesn't believe in the internet. So I don't think she would be going to Ask the Egg Whisperer to say hi to her daughter. She says, my husband's semen analysis came out sparkly. Nina, love you. That's adorable. 160 million total motile count. That's awesome. But morphology was 2%. What can cause low morphology, and what should I advise him to do to improve it? Thank you. Okay, Nina, one of my many, and I'll just show you guys the ball that I got for Christmas. I know it's not a ball, but it kind of looks like maybe a testicle. It should be like a picture for ballsmethod.com. My husband got me as a gift thinking that it was an egg, and I had to point out that it actually looked like a blue ball, and we had lots of fun joking about it. I hope you guys appreciate my humor, because I certainly do. For you, Nina, what I would do is this, ballsmethod.com. I know like a lot of people say like, oh, the sperm count is so good, so the morphology doesn't matter, but the shape does matter, okay? Size might not matter, but shape does matter. Ha ha ha. Okay, so what I would say is this. Thank you, Segline. I appreciate someone laughing with me, or probably at me, but with me. I appreciate it. So let's do another semen analysis first. If the morphology is still low, let's do a sperm DNA fragmentation test. We can get him to a urologist to check under the hood and see if there's a varicocele. We can check his testosterone. We can look at other things if he might be a little on the overweight side, perhaps check hemoglobin A1C. Let's maybe look at his lipid panel, and let's get him in a sperm fitness sort of routine, exercising most days of the week, sleeping really well, taking sperm-friendly supplements, a little CoQ10, and there's ConceptionXR from Theralogix. You guys can use code TUSHY, all caps, for the PRC price for that one. I think I already mentioned CoQ10, and everyone's vitamin D deficient, so I would have him start taking vitamin D. And I would say that assuming that IUI kind of fits into your family size goals and fertility roadmap, that might be a good option for you. And then assuming everything is good, but if let's say the DNA fragmentation is abnormal, maybe consider IVF sooner than later. And I would certainly say with a sparkly count of 160, I don't necessarily feel like you need to jump into IVF right away. I would say probably 3 to 6 IUIs. Yes, I did say 6 for someone who is, let's say, under the age of 32 feels reasonable, and even over 32. The most number of IUIs I've ever done for one person, yes, 23. The next highest one was probably 13, then 9. And I'm giving you the number they were successful at, and then 9, 6, and I have many families 3 to 4, okay? So this next question is from, and these are for people who they weren't ready for IVF, obviously. Not obviously, you know what I mean. I talk to people about their priorities and make sure that what we decide to do makes perfect sense for them. Next question is from Magnolia. Magnolia says, thank you for reading this. IVF. When do I decide it's the way forward? This sounds like a mystery novel. Background. I had one healthy live birth at 37. I'm now 39, and in the last year, I've had 3 miscarriages, a clinical pregnancy. One pregnancy was terminated for trisomy 18 and a miscarriage at 10 weeks. I'm sorry. I was diagnosed with PCOS 4 years ago, but don't have any symptoms. My cycles are regular 32-day cycles. I don't have irregular periods. Thyroid levels, testosterone, all normal. My AMH is 4.7. I don't seem to have a problem getting pregnant, but the past year, either my body has hung on to very unwell embryos or has let them go. There doesn't seem to be a rhyme or reason. Is this about egg quality? I'm taking all the supplements from It Starts with the Egg book, as is my husband. And when we do make the call, and when do we make the call that IVF is the option? I don't want to go through all the medications, but similarly, I don't want another loss. What are our chances of having another baby naturally by improving egg quality? So Magnolia, and I know you guys hear me talking about like these are the supplements that you can take to improve egg quality. At the end of the day, the supplements actually may not work. And I know that's like, what? Like she talks about these supplements all the time, but it's important to be very transparent and honest that a lot of what goes on with fertility and pregnancy, especially when we're 39, is just completely out of our control. It's just related to life, normal ovarian aging. That's it. So what you have to do is go to my website and put an IVF pyramid into the search engine. I'm doing this because you know that little search tool, and print it out and take it to your IVF doctor and be like, what will my pyramid look like? Like, what can I expect? Because with an AMH as high as you have an AMH of 4.7, you could get 20 mature eggs and you might have 5 normal embryos from that. But you also might get 20 mature eggs and you might get 0 to 1 normal embryos from that, because that could be told each embryo basically would have, probably about a 39 to 25% chance of being genetically normal. And so it's not like 1 out of 20 will be normal. It could be like you can get a whole bunch of embryos and still not get one that's normal. And that's so frustrating. There are a lot of things that are frustrating about being a fertility doctor, but that is one of the many things, is not being able to get a patient a normal embryo their first IVF cycle. It's super frustrating because I like to always be positive and hopeful for people. And when something doesn't work, it totally ruins the day. And that's putting it just a little mildly. So, I would say some tests that you can do. It doesn't sound like doing a chromosome analysis will be that helpful, but I would still possibly do that for you and your husband. I would possibly consider doing a sperm DNA fragmentation test on your husband's sperm before you guys do IVF. That's an easy test to do. It takes about a week to result. Make sure you're taking my special supplements, the NAD and the pterostilbene. I have to bring home a bottle of this. I tell everyone I'm taking it so that I can live forever. And he keeps saying, where's my bottle? I'm like, sorry. Last night he asked me too. He's like, where's my bottle? I'm like, I forgot again. Okay, hopefully I'll remember tonight and I'll bring it home. So I would totally do IVF given everything that you've been through. I don't want to take your youth for granted. Let's save the embryos, get those beauties frozen, and hopefully you'll only have to do 1 cycle to get enough embryos for the family size that you guys have always wanted. Next question is from Gina. Gina says, hello, Dr. Aimee. Hi, Gina. I had 3 normal embryos, 5BB, 5BC, 6BB. So for those of you guys who are like, what are those numbers and letters? Let me break it down. This is the I in embryodiamonds.com. The I is the embryo quality that dictates the implantation rate per embryo. So the 5 refers to how expanded the embryo is or how fast it was growing, whether it was hatching or not. The first letter, A, B, or C, refers to the quality of the cells that become the inner cell mass or the embryo part once inside the uterus. The second letter, B, are cells that are used to describe the trophectoderm, or the cells that become the placenta. And so looking at 5BB, 5BC, 6BB, we know that that Gina has fair to poor quality embryos. And I'll break it down a little more. They transferred the 5BB and it didn't implant. I will have a follow-up appointment for next steps, so I need your advice. The 5BB got a second biopsy for genetic testing. I'm wondering if this could be the cause for not implanting. My clinic does not recommend ERA, but I want to push for it, as well as receptiva tests and immune testing. When I asked for the ERA, initially my doctor said I will have to take birth control pills for that. Any clue why? My transfer protocol was with letrozole for 5 days, gonal for another 5, trigger shot, vaginal suppositories that contain progesterone, estradiol, Viagra, and clindamycin, plus other pills. Should that change my protocol? What else can I do to have a successful transfer? Thank you for all you do for us. So Gina, I'm wondering, number one, why did your doctor choose this protocol? It's a fabulous protocol, but there's something that's coming to mind when I see it. Do you have a thin lining? Okay, and let's back it up. Why are we doing IVF in the first place? Yes, that's part of the Egg Whisperer diet. Figuring out the D, the diagnosis. Why are we even here? So I feel like why we're even here will kind of tell us more about the right embryo transfer protocol for you. And I think you're right to think about all the things that you're thinking about right now. But the thing that I'm thinking is that you you are doing a stimulated transfer protocol, but you still were using estradiol and Viagra. And for those who don't know, Viagra isn't for, to improve desire or, improve sexual function during a transfer protocol. Believe me, it's not. I won't even make jokes because I can't even think of a funny joke because I'm not that funny. But the Viagra is actually given if the lining is thin. So that's where I really think we need that's I think what we need to talk about here, Gina, because if you have a thin lining, you should absolutely not use birth control pills. I get really fired up about pills and how they can potentially hurt people that are trying to get pregnant in certain ways. I mean, they're fabulous, don't get me wrong. They have a lot of non-contraceptive benefits. They have they play a great role in fertility medicine because we can use them to kind of plan things like egg freezing cycles, for example, and to make things fall on a certain day for patients. But if you have a thin lining, that's what birth control pills do. I mean, that's how they prevent pregnancy, is to thin out the lining. So why would you use birth control pills? So I would just maybe consider another protocol, perhaps. Take a really careful look at the lining, and maybe a medicated cycle could be better. Ask your doctor what your lining was on the day of the trigger shot for your IVF cycle also, and ask why the Viagra. That's kind of what I'm thinking. Okay, Olivia, this is your question. 1.5 years ago, we started trying. I had a subserosal fibroid, 8 centimeters, without any pain or irregular bleeding. It didn't distort the cavity. My husband has a varicocele, which is that dilated vein that sits on the testicle, that caused him some pain. Our doctors advised to try naturally and didn't want to do tests. That's nice. I'm just being a smartass. Sorry, didn't mean to swear. After 1 year of not conceiving, thanks to your TUSHY and balls methods, we did the test. Now I'm 35 years old. AMH is 0.39, FSH of 23, estradiol of 75. My prolactin, LH, thyroid hormones all normal. Tubes are open. I'm taking prenatals and supplements like CoQ10. Sperm, frag, all good. Oh, actually, I take that back. DNA fragmentation, 32%. Sperm motility is fine. We eat healthy, don't drink, don't smoke. A local IVF clinic advises to start stimulation ASAP with max amount of medications. And here are my questions. What do you think about the suggested protocol? Taking DHEA, yes or no? What dose would you suggest? Chance of getting pregnant with own eggs and sperm. So Olivia, at 35, the good news is you have 35-year-old eggs. You don't have a lot of eggs based on the AMH level. The AMH level suggests that your follicle count is probably around 4. So you might be able to get around 4 mature eggs, which is fabulous. My concern, though, is the sperm quality. It sounds like the varicoceles are what are causing the sperm issues. So you might want to talk to your doctor and see if there's a urologist that can help out and do a varicocelectomy and remove them. So what they're going to say is this. You're going to be like, oh, no, removing them is going to take about 9 months for there to be improvement. But the thing is this, your AMH isn't going to disappear overnight. It just doesn't work that way. So I think even if you're planning on doing IVF right now, you might still want to do the varicocelectomy and get his sperm in tip-top shape. It sounds like his testosterone level might be normal too. But if you haven't checked it, let's get it checked out. He might benefit from improving his sperm quality by taking things like Clomid, for example, and that might improve his sperm DNA fragmentation. But it sounds like what's going on is probably more anatomic than not. So as far as the medications you're on, saying that they're going to give you max doses of injectables, when your follicle count is less than 5, I'm not sure that that's necessarily the best regimen, but I don't want to interfere with your protocol at all. I would say just see what they think is best given the tools that they're used to using and go for it. I mean, be as aggressive as you feel comfortable being, and it sounds like you're doing IVF, and that's exactly what I would do. But I'm concerned with the DNA fragmentation that unless we do something to fix it, the embryos, while they might appear really viable, their viability might be lower. I've definitely had people get pregnant with IVF with DNA fragmentation levels in the 30s. I've had patients get pregnant naturally with DNA fragmentation in the 30s, but sometimes the embryo viability can be a little bit lower. So I just want you to, and it sounds like you already know that. So I would say varicocelectomy, and then if you are my patient, the protocol I would use is more like a mini IVF protocol to get all 4 eggs to grow. So for example, using Femara or letrozole, same thing. It's like saying tomato. It's like saying Tylenol and acetaminophen, or Motrin and ibuprofen. Femara and letrozole. Take that, maybe 3 or 4 pills per night for about 5 nights, and then bring in the injectables maybe after 3 or 4 nights, okay? And then you would add the higher doses once you look at the eggs and you're like, yes, this is a good idea. Let's keep going. This is a great cycle for us. Okay, next question. is from Elizabeth. See, you guys, this is so much fun for me. Elizabeth says, I love your videos. Thank you, Elizabeth. I love doing them. Thank you for the knowledge and sense of humor you bring. Well, I'm glad you think I'm funny. Here's my situation. I'm 41, AMH 0.95, and we're carriers of a recessive disorder that results in severe physical and mental disability. We had a little girl naturally when I was 40, but she didn't survive. We have a 25% chance of recurrence. To screen for the disorder, we did our first round of IVF, and we got results back today. Out of 7 eggs, 5 fertilized. 3 made it to blast. We have 1 normal that is not affected. There was another euploid, which means normal, and it was affected, and 1 with abnormal chromosomes. We're so happy to have a good one to use. We might want 2 children, though. I have 2 more rounds covered by insurance, but they can't be used for embryo banking. My question is, should I wait until after a healthy pregnancy with our good one to do IVF again, or should we do another round now, even if it wipes out our savings? Elizabeth, that's so maddening. That's really, really irritating that you have the insurance coverage, but they're telling you that you can't use the coverage now if you're trying to save an embryo. I wish that there was a way around it, but I would have to tell you, your fertility is precious. It goes away over time, and by the time you're 42 or 43, it could be too late. So even if you use that embryo right now, and hopefully it works, in 2 years, we may not be so lucky because of the fact that you and your husband share common variant for recessive disease. I would strongly suggest doing the embryos now. That's what I would do. Do another cycle, and I'm sorry that they won't cover it. Next question is from Sue. Sue says, hi, Dr. Aimee. Thank you. You're amazing. I'm 31 years old. My husband's 32. I've been off birth control for 4 years. We have not been trying, but we started really trying in a way by tracking my ovulation in the last 5 months. My cycles are every 23 to 28 days. My AMH is 1.82, AFC 6, FSH 8, LH 3, TSH 1.75, HSG is normal. Semen analysis, 36 million with 30% motility. We've tried Clomid first with time intercourse, didn't work, and my lining was too thin. That's what Clomid could do. You see, that's why I hate Clomid. I do. I feel very strongly about Clomid and the evils of Clomid. Honestly, I feel like it's like cigarettes. If people tried to get cigarettes FDA approved, of course they wouldn't. And if people tried to get Clomid FDA approved, it has so many bad side effects. I feel like it would never have been approved, but it is approved. We had 1 medicated cycle with Femera IUI that didn't work. And in November, we tried for a second IUI that was canceled because my follicle didn't grow. It went to 13 millimeters on day 10, and the next ultrasound, it got smaller. I'm not sure why that happened. I bet it happened because he probably actually ovulated. I had multiple cysts, less than 24 millimeters, and that didn't require intervention. I get a period every month, but I usually spot 3 to 7 days before my full flow. Should I try IVF or keep trying naturally? I might have stage 1 or stage 2 endometriosis too. Should I get surgery first? Sue, all this information is super helpful. Here's what I would do. Number 1, get your AMH level checked again. With the number of follicles that you have, it seems like there's some discordance between your AMH and your follicle count. I think it's really nice to just have the information. Your follicle count, your age, and your real life experience through fertility treatment really set the stage for like what our expectations should be. But sometimes when your AMH is high, like 1.82, doctors don't necessarily realize, like, I don't want to say doctors. I feel like I'll just say people in general might feel overly reassured about your situation and not try and move you into IVF as soon as they should be. So it sounds like someone has talked to you about IVF. It sounds like you've truly tried everything you can with Clomid and then Femera and then IUI. But at your age, I would take advantage of your golden eggs that you have right now. Let's go get those sparklers. Let's get them frozen and make some embryos. And then, go through Ball's method, see what your husband can do to make his sperm sparkle even more. Let's get them swimming even faster if possible. Do a sperm DNA fragmentation test. Consider a procedure like Pixie or use Zymote in the lab to get hopefully better quality blastocysts so that you may need less IVF cycles if you're doing something to improve embryo quality in the lab. And you guys all know the special supplements that I'm constantly talking about, but I would absolutely have you also consider taking them. And I would also have you consider doing HGH as well, because I think that might help you. But it sounds like there is an egg issue, there's a sperm issue, and it sounds like IVF would be the treatment to help the diagnosis. So, Sue, keep going. I would definitely try IVF as your next step. This next question is from Angela. Angela says, I was diagnosed with low AMH, 0.09. I'm 36 years old. We did all the tests we could. We did a uterine biopsy, all is good. My husband's sperm is average. Not bad, but great. Not bad, not great. Not bad, but great. not bad. I should stop saying that over and over. We did 2 IVF cycles. IVF 1, I got 2 eggs. IVF 2, lower stim approach, I got 4 eggs. We had a total of 3 embryos from both cycles, and they all came back abnormal. I read the embryologist reports, and what I researched from the notes basically said my egg quality was poor on both cycles. Should I go forward with the 3rd cycle or not? If so, what protocol would be best? I was thinking mini IVF, but I don't know if it's worth it. Is it worth considering a sperm DNA fragmentation test for my husband too? They've not done hormone tests on him ever. Thank you so much. So Angela, yeah, I mean, if his sperm is not bad, but not great, so yeah, let's just look at his sperm again. Let's just learn everything. Do a sperm DNA fragmentation test. And in the meantime, get him on supplements. Like, every woman takes prenatal vitamins. Like, we're told, you know that. Like, we all know that. And, like, guys are like, well, my sperm is not bad, so, like, why should I do anything? And I'm not saying that your husband has that attitude, but a lot of guys do. So I'm like, no. Just take the same vitamins that your wife takes. You guys know that prenatals are multivitamins basically with a fancy label. So guys can take them. Some guys are like, I'm not going to take a prenatal. I'm like, dude, like, it's not going to turn you into a pregnant chick. Like, I promise you. I haven't seen it yet. But one day, I predict, one of my April Fool's jokes, I think it was like 2 years ago, 3 years ago, maybe 5 years ago, the first male uterine transplant. I joked that I had performed the first male uterine transplant, and this is not a joke. Someone from NBC News called me, and they're like, we want to interview the patient now. Is he out of the operating room? And I'm like, can you look at the calendar, please? Back to your question, Angela, it sounds like your AMH might be a little bit higher than 0.09. If you're still able to get 4 eggs, I mean, that's pretty fabulous. So repeat it. Let's see what's going on. It's probably meandering a little bit. Look at your FSH. And I would say at 36, given the number of cycles that you've done so far, which is 2, if you're still open to doing 1 or 2 more, go for it. Some other styles of stimulation in a case like yours could be doing something like a mid-luteal stimulation. Work with a doctor that has experience with that. And as long as the egg count is good, go for it. So you might get a really good response that way. Some other doctors like not doing genetic testing and just transferring fresh. I would say that's a one-on-one individualized discussion that I have with each and every one of my patients to make sure that, again, I'm honoring their priorities. But that's a conversation to have with your doctor as well. Okay, next question's from Andrea. Andrea says, hi, Dr. Aimee. I'm 34, trying to conceive for 14 months, day 3, FSH 8.7, TSH 2.14, estrogen 88, LH 5, prolactin 9. I had my first RE appointment today. Waiting for the AMH, but the ultrasound showed around 5 follicles on the left and 1 on the right. So total follicle count, you guys, if you're following me, 34 years old, AFC of 6. He wants to wait for AMH, but thinks I have decreased ovarian reserve. Oh my God, you guys, do you know what he told her? I have the ovaries of someone who's 45. Okay, that's horrific. Like, I would never, ever, ever, ever say that to anybody because you're 34, you have the ovaries of a 34-year-old. I mean, that is like so mean. I mean, like, I get it. Like, people want the shock and awe of like scaring you, like you need to do IVF immediately. But I promise you, your eggs don't disappear overnight. And I promise you, first of all, there's nothing bad about having 45-year-old ovaries. I do. But at 34, it's impossible to have 45-year-old ovaries, and they can't look 45, you know? Mean. He doesn't believe in supplements. I can tell you there's nothing to believe in. It's just you take them and see if they work for you. And he's recommending 2 IUIs and then IVF. I want 2 kids. What supplements would you recommend for me? I currently take 200 milligrams of ubiquinol, and what treatment plan? I definitely need a second opinion if he doesn't believe in supplements, right? Andrea, you know, there are a lot of people who are like, take whatever you want. And like, whether they believe in them or not, I get it. Like, you know, I mean, if you don't have the experience of like having someone do a cycle with no supplements, and then they come to you and you put them on supplements, and then it's like, holy smokes, they have the most gorgeous embryos. Of course you're not going to believe in supplements. So if he doesn't do that or have that approach, I mean, that's just his, what am I trying to say? Je ne sais quoi. His, help me, somebody. My husband's really good at word finding. I don't know if you guys knew this. Maybe I've said it before, but he does all my mnemonics for me. Tushy method, him. Balls method, him. Sparkling eggs, him. Age, you know, egg quality is age, genetics, environment, him. Egg whisperer diet, him. Basically, I can't divorce him ever because he's like so good at this stuff. He's an ER doctor. Great guy. Love him to death. I say this because I should be home cooking dinner for him. Just kidding. Okay, anyways, I'm actually quite hungry. That's why I said that right now. So Andrea, at 34, trying for over a year, 14 months, I would tell you this. Skip the IUIs, go right to IVF. Why wait, right? I mean, if you were 34 with an AMH of, you know, or a follicle count of 6, we would be telling you if you didn't have a partner to freeze your eggs, especially if you wanted 2 kids. So I'm telling you now, skip the IUI route. Your 36-year-old self will be thanking you, and you're going to feel so much better knowing that you have embryos frozen. Just do the work now. Just get it done. Obviously, I'm biased. I think it's worth it. And I think all my patients who are, let's say, 40 years old, I can hear them now. They're in the room. They're like, Andrea, just listen to her. I wish that I was smart like you at 36 or 34. Sorry, I didn't mean to make you 2 years older. And froze embryos too. So they're all talking to me to tell you that. Okay. This next question is from Carly. Hi, Dr. Aimee. I love tuning into your show. I think it's amazing how much you help people. I'm 31. I have a low AMH. My AMH is low. She gave me units from Canada, and I don't know how they convert into US units. I should learn that really quickly. I should have like a little calculator, because you guys do such a great job listening to me from all over the world. And sometimes I can't switch the units real quick. My husband's 33, and he has normal sperm. I've done 3 IUIs using gonal F50. I produced 2 to 3 mature follicles each time. However, none of them worked. I'm starting IVF in January. When my AMH was tested, my follicle count was 15 the same day. My FSH has ranged from 7 to 11 throughout my day 3 test for my IUIs. I'm scared about my FSH numbers, but happy I respond well during my IUIs. I've been taking multivitamins, CoQ10, vitamin D, NAC as supplements. What do you think my odds are of getting a few embryos with IVF? My doctor thinks it's a good shot, but I wanted to see what your thoughts are considering my numbers. I think it's absolutely fabulous. I mean, if your follicle count is, if your response rate is that high, producing 2 to 3 mature eggs with each IUI cycle, and you have a follicle count of 15, Carly, I think that you have a great chance of pregnancy with IVF, and I hope that you guys are successful in your first cycle. This next question is from Saksha. Saksha says, Bonjour, Aimee. I am Saksha from France. I had 2 day 5 B2, so BB quality embryo blast transferred. I've been prescribed progesterone 200 milligrams vaginal in the morning and in the night for 14 days after the retrieval. I've been asking the medical team if I should continue if I'm pregnant, and they said no need. 14 days should be enough. I had ICSI in 2016, and another center was prescribed further for 10 weeks after a positive result. What are your thoughts, please? Thank you very much, Saksha. So, Saksha, this is the thing. Let me tell you. When we do an egg retrieval, what do? We're going to aspirate cells that secrete estrogen and progesterone. You have to replace those cells. The placenta doesn't take over until 7 to 9 weeks, and in some people at the 9-week mark. Most people 100% by 9 weeks. Some people get super freaked out about stopping, so they want to stop at 10, and I have patients that like to stop at 12 and even sometimes 14 weeks, and I'm like, let's do it. Sometimes we taper, sometimes we check progesterone. I just always tell my patients, what would you like to do? This is what I recommend, and I'll do whatever you want because I want you to feel really good about stopping. So my recommendation is always to ask questions. And I think since you took them through your 10-week mark after your last pregnancy, someone's probably not telling you accurate information. So I would not stop them after 14 days. That would be terrible or terrible. Is that how you say it in France? In French? Believe it or not, I used to speak French. It's been so long though. Okay, this next question is from Jally. Jally says, hello, Dr. Aimee. I always watch your YouTube channel. I'm 31 years old. I have 3 blasts, 2 are PGT-A normal, and I'm still waiting for PGT-A testing for our 1 non-tested embryo. This is my first time doing IVF, and I'm planning to do ERA testing because I have 1 normal embryo graded BA, and 1 non-tested is BA as well, but the other normal embryo is CB, which is low grade, I think. And the answer is yes, that's right. Do you think it's the best decision to do an ERA test? And I say yes. And here are the rest of her questions. I'm currently a nursing student. In January, we would have in-person class and planning to do a transfer in January as well. Do you think it's safe to be vaccinated prior to the transfer? And I say, Jelly, wait, get vaccinated and then transfer. I would totally vaccinate before the transfer. I have zero hesitation telling you to do that. Of course, talk to your doctor, because my advice on Instagram and YouTube and my podcast is not to replace the individual medical advice that your doctor and physician are giving you. But I'm still going to tell you what I would do if you were a patient of mine. Hopefully you'll tackle about this COVID vaccine issue. I'm planning to get pregnant. Sorry about my grammar. I just came to the US 3 years ago. Thank you, and more power to your show. I grew up with immigrant parents, and I have so much fun with their grammar, and you never have to apologize from it. My dad actually, what did he say the other day? He said, oh, so fun. I can't even remember. And I can't even think of it. It was so fun. But when I think about it, I'll tell you guys what he said. So yes, I would definitely consider doing the ERA test. I would definitely consider holding off on your transfer, getting the vaccine first, and then transferring. Next question is from Maggie. Maggie says, I'm a 30-year-old woman with POF. For those of you who don't know, POF stands for premature ovarian failure. I don't like the word failure, so I like to call it insufficiency. I'm doing a frozen transfer with an embryo from a donor egg. That's awesome. I also have early stage cirrhosis, slightly elevated liver enzymes, and irregular liver texture, and TPO antibodies in the thousands. Should I be concerned about miscarriage? Is there anything I can do to improve my chances? Ooh, okay. Maggie, let's talk. Let's see. Why are the elevated enzymes up, and why do we have early stage cirrhosis? Are we dealing with the body size thing? So there's a condition that I've seen before, and it's called fatty liver. And women who have fatty liver can have some of these issues, and that can cause something terrible, and that's cause put us at an increased risk of having preeclampsia, and that would or having people confused if you have preeclampsia or not. So that's one thing. The other thing is with the thyroid antibodies in the 1000s, just make sure all your thyroid function is normal. And if your thyroid antibodies are trending up, that's one thing. If they're just always in the thousands, that's another thing. But I would say maybe if you haven't already, and it sounds like you probably have a GI specialist, but I would talk to a high-risk OBGYN, and I would perhaps just kind of track and trend those thyroid antibodies and see what's going on. There's a medication that kind of works in a way that I have no idea how it works in bringing down thyroid antibodies, but I've used it, and I've actually asked people, like, how does this work? And no one can really tell me. They're like, I don't know. It's a way it just works, and that's using naltrexone to bring down thyroid antibodies. So I've definitely seen that as something that can help. So talk to your doctor about some of the things that I shared with you. But I would say I'm not necessarily worried about miscarriage. I'm actually worried about pregnancy complications in someone who has cirrhosis. So I would I don't know how many embryos you have from this donor egg, but I would say maybe take some more time to kind of explore what's going on if you haven't already. It sounds like you probably have. Okay, Maggie is saying, I'm Maggie, my BMI is normal. Well, I don't want to ask you too many personal questions on here, Maggie, because I don't, unless you want to tell me, but I feel bad asking. Okay, so now I'm going to get to your live chatted questions. I'm going to start from the beginning here, and here we go. So first question is, let's see here, going to the questions. Should 200 milligrams vaginal progesterone for an FET be taken twice a day or 3 times a day? For me, if you were my patient, I would have you do it 3 times a day. Night nurse is saying, I had immunity testing done in Toronto with a doctor. He said I failed everything, so overwhelming, couldn't absorb everything he was saying. Have started on dexamethasone and have to do Humira. Okay, shot and the LIT procedure. You know, the way I think about it, that stuff is a little controversial. But if that's a tool, if those are tools that your doctor uses and they're in their toolbox and they feel really good about it and you feel really good about it, I would say it's hard for me to give thoughts on that because it's not something that I do. And I'll just leave it at that. Next question is, hi, Dr. Aimee June. So for those of you guys who aren't Middle Eastern, we say June, which means like my dear. So she's saying Dr. Aimee June. It's a word of endearment. So thank you. I'm 37, got 3 chromosomally normal embryos after 2 failed IVF cycles. Do you recommend another retrieval for having 2 kids or do a transfer right away? It really depends, Somaya June, on the quality of those embryos. So let's look at the quality and see what the quality is and then decide. And then if you did, this is a little pearl, if you did IVF because your husband's sperm is bad, assuming that you didn't use donor sperm, let's get that sperm frozen in case you need to do another cycle in the near future. Maybe if the next transfer didn't work, it'll be nice to have younger sperm depending on his age. Next question, what is the best protocol for HGH? My doctor wants me to take 5 vials for 10 days. Wow. I bet it's maybe 5 units for 10 days. I'm 41. I had 15 embryos, all abnormal. I don't think it's 5 vials for 10 days. That's quite a lot. I'm thinking that maybe 5 units. So I would ask them about that. Next question is, what's the latest in improving egg quality? There really isn't anything that's, new and exciting. I wish there was. I wish I could be like, you guys, there's this new technology. I have to tell you about it. This is what you do. And it makes your eggs sparkle. Right now, the best thing that we can do is, take supplements, sleep well, eat healthy, avoid environmental toxins, and, some patients like HGH can work with them or for them and help them. Other patients, it doesn't. Next question is, I was diagnosed with stage 2 endometriosis. The surgeon found it on top of my bladder, but she said my tubes are clear. I've been struggling with infertility for almost 8 years. I'm sorry about that. So endometriosis can affect egg quality. So anytime I hear that, I think about egg quality. So I would say maybe take N-acetylcysteine. There's a great book. What is his name? Dr. Cook, I think. It's a great book about diet and endometriosis. That's something that you might want to get and read. And then, anyone who has endometriosis, I think of it as a fertility threatening condition. So I'm just like, save the eggs, freeze them while you can, because they can affect egg quality, or it can. Next question is AMH of 6.8 too high for a 32-year-old on day 3? Or is that because of PCOS? Is PCOS giving you bad eggs? So the answer is AMH of 6.8. It can be quite fabulous. It could just mean that you're just a young person with lots of eggs, but if you have irregular periods and all the symptoms of PCOS, then it could mean that this is a sign of PCOS, but PCOS isn't necessarily a bad thing. You can, manage it, you can control it. It's not something that necessarily gets treated, but I think with the right team and the right approach, you can manage it and make sure that it doesn't disrupt your fertility as much as it possibly could if you didn't have it under control. Next question. I'm 39. I've had 3 failed IUIs and 5 failed IVF cycles with 1 miscarriage. My doctors only use Golan, times Menopur, and Ganirelix for triggers. Should I be worried that she hasn't varied my med protocol? So 5 IVF cycles with 1 miscarriage. I imagine there's a reason why they're using the same protocol. It's possible that you're just making beautiful blastocysts. I would perhaps look at genetic tests that might reveal something. Maybe look, I'm not sure if you're transferring every time, but perhaps look at your uterus and make sure you're not missing anything. Look for adenomyosis, look for endometriosis. Someone just asked, what's BCL6? It's a marker that it's a stain that's highly sensitive for endometriosis. It's done on the lining of the uterus, and it's through a test called Receptiva. The next question is from Shayla saying, my husband's sperm analysis came back with 12% rapid progression. Everything else was normal in range. Should we try more IUI cycles, or would IVF be our best shot? So I would get a workup, go through Ball's method. Ballsmethod.com is where you can find all that information. Repeat a semen analysis and see if it's still the same. If it's still the same, it might make sense to move to IVF if you guys have already done a few IUIs and it hasn't worked. Dr. Aimee, I hope you're well. Always so grateful to see you. I'm heading to my first preconception appointment, 34 years old, 1 miscarriage, 1 ectopic. What should I look out for and ask? So look for a tube test, so do an HSG, do an anatomic evaluation of your uterus, ruling out a septum or a uterine anomaly. I would make sure you've done an AMH level. Consider doing autoimmune testing and enough genetic screening like a chromosome analysis for both you and your partner. Next question is from Christy saying, I'm 36 with an AMH of 0.85 to 1.14. I'm doing IVF in January. My follicle count was 6 this month. I canceled it, and it was canceled due to COVID. My protocol will be Clomid, Menopur, Follistim. How many eggs and healthy embryos would you anticipate? So if your follicle count is 6, I would say at 36, follicle count of 6 with that kind of protocol, maybe you'll get 4 to 5 mature eggs, maybe 2 to 3 will fertilize, and maybe 1 to 2 will reach the blastocyst stage, and you could get 0 to 2 healthy embryos with that kind of protocol. So talk to your doctor about what they're targeting for you as far as the dose of the medications. I imagine they're hoping to get at least 6, so hopefully you'll get 1 embryo per cycle, and you might need to do more than 1 to get at least 2 embryos, but maybe you can get 2 in the first cycle as well. Next question is, what do you think of 30 days of, I don't understand that question, so I'm going to move on to the next question. My husband's DNA fragmentation was good, but his OSA was 6. I'm assuming due to his varicocele. Anything over 4.4 is abnormal. We were told not to do surgery. His motilio count is okay. What would you do? In a case like that, I would look at his testosterone level. If his testosterone level is good, I really wouldn't worry about it. I would make sure he's taking sperm-friendly supplements, the ones that I talk about all the time, like CoQ10 and the Theralogix ConceptionXR. And then maybe ask your doctor to add something like Zymot or Pixie. Next question is for Night Nurse. Thank you for reviewing my question. I had immune testing done and was told I failed everything. I'm now on Dex, Humira, LAT, and I have to do IVIG, and I'm waiting ERA. Next question is, what do you think of 30 days of priming with estradiol and progesterone with Omnitrope for low AMH DOR and early ovulation? So I think it just really depends on your age, how low your AMH is, how high your FSH is, because sometimes it can help bring down your FSH if that's the goal, depending on how high it is. So there are situations where I do that, and then I kind of follow the FSH, and then once it drops, then I start stim. But taking estrogen and progesterone, especially when you have a low AMH, can sometimes be overly suppressive in some patients, and it might yield less eggs. Let's see here. Next question is, my 2 cycles have been canceled for poor response and early ovulation, like 4 days into stim. Protocol, letrozole, Follistim, HCG, LH of 20, all of these things together. So I would say, I'm not sure if you're taking HCG shots, but maybe let's not do that anymore. Maybe we're not dosing it correctly. Do the letrozole, do the Follistim, but a couple things that you can do there. You can take Ganirelix at the beginning of your cycle, maybe even like 1 or 2 days before your period starts, or you can take it like at the start of the period, and then continue the stim from there. So that's one way to prevent early ovulation. Next question is, what causes dark brown spotting before your period 4 to 10 days before full flow? So it could be that literally, it could be your period starting. It could be a sign of low progesterone. It could be a sign of a uterine polyp or a cervical polyp. So those are all things that you can look for. Next question is, do I work with good doctors in Scottsdale? Yeah, I love, I think it's IVF Phoenix. There's a great doctor there. And he's not necessarily in Scottsdale, but in Phoenix, obviously. I think actually they have an office in Scottsdale. Let's see here. After you said, so Kelly in Toronto is asking, after you start injections for IVF, how soon would you do an ultrasound? I'm concerned mine is planned for the 9th day. Kelly, I would be concerned too. I tend to bring patients in, just kind of depending on the number of eggs you have, your age. Sometimes I bring you in even after like 2 days of shots. Sometimes it's after 4 days. Very rarely it's after 5 days and you're coming in on the 6th day. And never have I brought someone in for their first ultrasound on their 9th day. So next question is, hi doctor, have you seen healthy births from embryos with DNA fragmented sperm? Is there a significant difference between PICSI and ICSI? So I personally feel like there is a difference between ICSI and PICSI. And if the DNA fragmentation is over 30%, I always counsel people about the possibility that the embryo viability might be lower. And that's why we add things like PICSI. That's why I came up with Ball's method, because I had too many experiences when people had abnormal sperm, and I learned it after they'd been through cycles previously. So, but I absolutely have had patients with DNA frags that are like in the low 30s that have still had healthy embryos and deliveries. But I think that if you're over 35, that's where I'm like, you know what, we might want to consider, doing some more testing, maybe a sperm aspiration instead of using ejaculated sperm. Let's see here. Is laser hair removal okay during the IVF process? I don't see why not. I definitely wouldn't say you can't do it. Next question is, my vitamin D is 20. I'm on 2,000 international units. My AMH is 0.2. I'm 34. Can increasing vitamin D to 4,000 increase my AMH? What is ideal? So my goal is to get your vitamin D. Yeah. Oh, I see what you're saying. Is increasing your vitamin D to 40 to 50. Can that increase your AMH? It's possible. I would continue to take your vitamin D, take it with your fattiest meal of the day, and maybe go up to 4,000 units. Next question is, would you recommend PGT testing for a 33-year-old? I did 3 IVF cycles, AMH is 0.8, FSH is 7, but first egg retrieval I got 1 abnormal, and second I got nothing, and the third I got 4 embryos. I would consider it. You don't have to do it, don't feel like you have to, but I think it might give you more information as to why, about what's going on. Next question, is it possible to increase the follicle count? And I would say it isn't. There's cycle to cycle variation. These variations are not something that we can control. You can't will a follicle count that's higher. The follicle count goes down over time, and eventually 100% of us will have a follicle count of 0. And for a lot of people that can happen at, in our 40s. For some people, it can happen even earlier than their 40s, and that's why I'm constantly saying, get your levels checked, get your levels checked, get your levels checked. You guys probably all can chant my Egg Whisperer golden rules so that no one looks back and says, why didn't someone tell me this? But unfortunately, the only thing that you can do to increase, or no, it's not the only thing. There's really nothing you can do to increase your follicle count. What you can do is freeze eggs when you're younger to use when your follicle count is lower. Next question is, hi, Dr. Aimee, starting IVF in January and have had mild adenomyosis is a form of endometriosis in the wall of the uterus. My doctor has said this shouldn't affect anything, but I've read it can. Is there anything that can be done or help? So there are a couple things that I could do in a case like yours for mild adeno. Number 1, do the BCL6 test, the receptiva test, exactly, to get the H score and see what's going on. If there's mild adeno, there might be endometriosis outside the uterus, and that might be affecting the tube. So rule out hydrosalpinx if you haven't already with an HSG. Take N-acetylcysteine, that's the other thing. And the other thing that I would do in a case like yours is add Femara to your transfer protocol. And if you have pain, if you actually have symptomatic, if you have painful periods, consider doing Depo-Lupron as well, maybe for 1 month before you transfer. There's only one doctor. Someone's asking me, what's the name of the IVF doctor at IVF Phoenix? There's one doctor there, I think. And do I know any good doctors in Delaware? I can't think of one right now, but I think that I could be totally wrong, but I feel like Boston IVF might have a satellite there, but I'm not sure. Next question is from Sheila. Also, after embryo transfer, my doctor suggested 2 100 milligram progesterones twice a day. Is this enough? Thanks so much. So the easiest way to find out is test your progesterone. Do a blood test and see. I don't necessarily use it just twice a day. I use it 300, so that's kind of my approach. Okay, next doctor here. Lucky Lucky is saying, a fellow REI doctor here. What are your thoughts on selenium for antithyroid antibodies? I've started using this for my patients. That's awesome. I mean, I haven't used it yet, Lucky. I'll look it up. Naltrexone has just been like something that a functional medicine doctor, she was actually an MD who is like double boarded internal medicine and functional medicine or integrative medicine. And she used it on a patient of mine. And I was like, just my socks were knocked off when I saw what happened. And then I've been using it a lot ever since. Next question is, my doctor never checked my AMH, only my FSH. I'm 32. I only made 8 eggs with 300 of gonal. And someone's asking for a good doctor in Toronto. I have like no sense of direction. I just know Toronto's in Canada. I basically need to use GPS to go home. I know where to put an embryo, but that's about it. So if I started talking about doctors in Toronto that were really good, you would all laugh at me because you'd be like, well, that's in Vancouver and that's in Montreal. So message me who's in your area. Direct message me and I'll tell you, because I know I know the fabulous doctors in Canada. I just don't want to make a fool out of myself right now. Okay, guys. It's awesome to be here, but it's time to go home. So thank you guys for joining me tonight, and I look forward to seeing you guys again here soon. I'm going to say Happy New Year, because I'm not going to see you guys until next year. This is my last show, my last Ask the Egg Whisperer show until 2021. So until then, I say goodnight, and I hope you guys all keep sparkling and keep up that positive and hopeful attitude. And hope isn't meant to be annoying or not realistic about what's going on in the world, but it's to have only positive, practical, and pragmatic expectations. So I hope you guys have a great night. Be safe, everybody. I love you all. Good night.